Thank you for that very kind introduction. Here today to present some ongoing research that I've been doing with one of my colleagues in the United Kingdom, Peter Llewellyn-Jones. Peter couldn't be here, but I'll be presenting the work that we've been working on for the last few years. The title, as you see, is Positioning Interpreting the Concept of Role Space. Peter and I, when we first started working together, really have seen the problems of the concept of role as it's been played out in interpreting, both in terms of the interpreting literature, for the most part, and also in terms of how we frame the role of interpreters in codes of ethics and in practice, and often in training as well. So before we go on to talk about interpreted interactions, I think it's important that we go back to first principles. Let's look at what happens when people are communicating monolingually with someone else in a familiar setting. So what do people do in normal monolingual interactions? What are the foundational principles, the underlying rules for communication? The important part here is we're talking about interactions where people are non-antagonistic. So people are attempting to communicate with one another. And that is, jointly construct meaning or have a conversation. So let's look at that first, and then find out how this will play out when we talk about people who don't share a language and are working with interpreters. So one of the first principles, which will be familiar to many people, is from GURIEC, the idea of the cooperative principle. Underlyingly, people are willing and able and are attempting to cooperate during a conversational interaction. GURIEC refers to this as the cooperative principle. We won't be going into detail, and the references will be available at the end. But the basic point is, GURIEC says, during a cooperative interaction, people follow a few very simple rules. Now, these rules are culturally based and also situationally based and can vary somewhat individually. However, overall, these are the rules that people are agreeing to follow and assuming everyone else is following. First rule is the rule of quality. Quality basically says when you're cooperating during interaction, tell the truth. If in any way I am saying something that I don't believe is true or I don't know is true, I will mark that. So common ways we do that in English is saying, I'm not sure about this, but. So we're signaling that although I know I'm supposed to be telling you 100% truth, if I have some doubt about the veracity of what I'm saying, I'll let you know that. Second rule is the rule of quantity. We say the right amount of information, not too much, not too little. Third rule is relevance. We say things that are relevant to our conversation. If we're going to change the topic, we mark that somehow. And the final way is manner. We communicate in a way that's appropriate to the situation. Such areas as register, level of formality come under there. So generally speaking, people are attempting to cooperate. Next, before we talk about interpreting, the concept of role is not something that's unique to interpreted interactions. Irving Goffman, the sociologist in the 50s, and even further back in sociological theory, we see that there's discussions of what are the roles that people enact during conversations. And this is a crucial point. Many of the metaphors or discussions about role of interpreting have assumed, or at least had some preconception, that a role is something that one has. Actually, in sociological theory, roles are things that we enact. It is through our behaviors that our roles are actually created. So we'll talk a little bit about Goffman's work. Goffman said that and some of the literature that you'll see seems rather spoken language centric, and that's because it's a function of its time. So Goffman said you can generally talk about people being speakers, that is, users of language, or hearers, that is, receivers of language. So you'll see the term speaker and hearer, but what I want you to think about is producer of language and receiver of language. What Goffman said is it's not a simple split between merely producing and merely receiving language. Actually, there are sub-roles, more complicated roles, that both speakers, users of language, and hearers, receivers of language, actually enact. So the sub-roles that Goffman talks about in terms of speakers, or those producing language, are the most obvious one, what he calls the animator, the person producing language. So obviously stated, I'm actually producing language right now. However, it doesn't stop there. Goffman also says that another role that can be enacted as a speaker is the role of author. In this case, I'm actually talking to you about Goffman's work. I am authoring and animating the language, but the ideas are actually Goffman's. The research that we'll present later is the work of myself and a colleague. So whilst I'm animating the language, I am one of the authors, as is my colleague. The third role is principal. It's who's responsible for what's being said. The classic example for this is a political speech. A speech given by a politician, the politician himself or herself is the animator. Oftentimes, they're not the author. The author is often a committee of people who might never be known. And the principal might be the government in power that's responsible for what's being said. So in terms of speaker roles, all these roles can be inhabited and enacted by one person, or they can be split amongst the participants. Crucially, also, we move amongst these roles during a conversation. So even the concept of speaker or producer is not as simple as it would appear at face value. Now let's take a look at the other side, the hearer or receiver of language. Again, not as simple as it would seem on the face of it. Goffman talks about a few roles. One of the most common ones is addressee, so the person to whom, or people to whom I am directly communicating. So while there might be, for example, a classroom situation, I might speak to one student because I'm addressing them directly. The other students are what are considered ratified recipients. They're in the situation, expected to be in the situations, although they might not be addressed directly. As we saw with speaker roles, we can inhabit some or all of these roles during the course of a conversation. Goffman also said, well, there are concepts of recipients in general. So for example, someone walking by a classroom while a class is going on, unbeknownst to the teacher and students, might overhear something. That person is not directly ratified or in the conversation, but perhaps could be receiving the language. The final role, which I think will have an impact on interpreters, is the concept of auditor. Classic example for this, again, we'll use a classroom example. A teacher who is teaching in a classroom has to be supervised by a senior teacher. The senior teacher is in the classroom not to learn, as the students are, but to merely observe the teacher and maybe perhaps comment on his or her performance. The perception of that supervising teacher is one of auditor. They are allowed, ratified that is, to be in the situation, but they are usually not addressed directly, and they can have there can be a perception of evaluation. This can have an impact when we talk about interpreting. For example, if an interpreter is in a situation with another professional, they may be perceived as an auditor by that other professional. So we've had speaker roles and we've had hearer roles. Let's move on. Both Grice and Goffman have work that goes back into the 1950s and 1960s. Some recent work, for example, by Garrett and Pickering, have looked about the way socio- and psycholinguistically people actually contribute and work with each other in situations. The concept they talk about is one of alignment. It is how the individuals involved in an interaction align with each other. So let's see some examples. So there are two broad areas when we talk about alignment. The first is what we call sociolinguistic alignment. That has to do with the behaviors, the use of language that interlocutors will use to increase or decrease social distance. So for example, if I meet someone for the first time, our social distance is rather great. When one introduces oneself, the attempt of that is to decrease the social distance in some way, often to find commonalities. So there's ways, either using language or paralinguistically, perhaps using body language or other behaviors, that we signal we want to increase or decrease the social distance. This can also be reflected, as mentioned before, in things like register, the level of formality, which is the level of social distance between two interlocutors. The other type of alignment is what's called psycholinguistic alignment. The idea here is that we are not merely firing utterances back and forth at each other, but during an interaction, we are jointly constructing meaning. and we jointly construct meaning in a variety of ways. We negotiate what topics we're going to talk about. We negotiate how we will talk about them. Oftentimes people, if they use a word, the other person will use the same word in order to signal that they're jointly constructing meaning. So this concept of alignment, which as we'll see will play out in terms of roles of interpreters, is key to how people actually jointly construct meaning, but also signal where they want to be in terms of the distance from each other socially and psychologically. Let's look at the final piece in terms of what people do when they're communicating in monolingual, non-antagonistic interactions. The final area that we'll look at, and again, which will play out when we talk about the concept of role in interpreted interactions, is what's been called accommodation theory. Again, some fairly new research that's come out by Giles, Coupland, and Coupland. So let's take a look at what they mean by accommodation. There are three stages that can happen when people are accommodating each other during an interaction. The first is convergence. Remember, when we spoke about alignment, we talked about how we're trying to decrease the social distance to a certain comfortable level. This is what happens. We converge with our conversational partner to a certain point where we feel comfortable. Once that convergence happens to a level that's appropriate given the situation, given the nature and relationship of the interactants, then there is a phase of maintenance. So we tend to maintain the interaction. That is, we do not increase or decrease the interaction. And then finally, towards the end of the interactions, we have divergence. Let me show you graphically some examples of what this looks like. So again, a situation, if you imagine two people who are somewhat familiar with each other, perhaps colleagues, not close friends, but colleagues, who meet at a conference, for example. The initial distance between them is appropriate, social, and probably somewhat formal. So at this point, the attempt is, if they're willing to cooperate with each other, a la Grice, is that they want to converge to a comfortable level. So they find a social distance, a convergence level that is appropriate for the interaction that they're doing. For example, again, meeting at a professional meeting. We then have the maintenance phase, where once that social distance is found to be appropriate, that's the social distance that's kept during the rest of the interaction. What happens when a third person comes into the interaction? So these two people have converged to a certain appropriate level, are maintaining that level of accommodation, and then a third person comes up whom they decide or they want to be a part of that. Well, that social distance, that distance that they've accommodated to, has been negotiated between the initial two interactants. The third person was not part of that. So in order for the third participant, participant C, to become a part of the interaction, the first two participants, A and B, have to diverge slightly to create space for that third person. This divergence can be signaled in a variety of ways. Pausing of the conversation is probably the most obvious one. Turning toward the third participant by both of the first two participants. Body language that shows a willingness to open up. And also, if someone does not want a third person to join the conversation, they do the opposite. People continue to talk. They continue to maintain eye contact with their initial interactants to not allow that space. But once the first two participants have diverged, then the third participant can join the conversation. Now, we get the opportunity for all three participants to converge between and amongst each other. So we went from having a dyad to a triad. And it is because of this convergence, maintenance, and divergence that allows this to happen. And again, once this conversation is ended, all three participants will diverge. What we're talking about are idealized situations here, and you can imagine in your own life, you can have a three-person conversation where one or two of the participants might be primarily if you will, animator and author of the statements. However, that accommodation is still happening amongst the participants there. So that gives us a background on what we do in monological interactions where people share a language. But what's interesting, many of you have probably had this experience, we can still communicate with people with whom we don't share a language, obviously with not as much success. So for example, if you look at this diagram, even in situations where the two interactions don't share a language, there is a possibility for some co-construction of meaning. It might be using slight words that one knows from the other language, using gesture, using things in the environment. So even when two people don't share a language, there still is a possibility of convergence. Oftentimes, interpreters assume that the only way a deaf person and a non-signing hearing person can communicate is with an interpreter. But if we allow people to actually have some joint construction of meaning without us, they can actually align and accommodate with each other. So let's look at now an interaction, and let's talk about what happens when that third person, that participant, is an interpreter. So recall, when we had the initial two participants and the third participant coming, there had to be divergence, and then in order to allow the third participant to converge with the others. However, not all the time, but what often happens is, instead of performing this triad, as we've seen with monolingual interactions, sometimes the interpreter literally gets in the way. So instead of having the possibility of this triadic interaction where the three participants can converge, the interpreter often literally gets in the way of the two participants. So instead of having interactions, what we end up with are monologic interactions. So interaction going from participant A to the interpreter to B and back again, without oftentimes any possibility for the participants on either side, even if they don't share a language, to accommodate in some ways. And this is incredibly problematic because it changed what should be an interaction into something that feels like a series of monologues or a series of one-way utterances back and forth, crucially through the interpreter. If we have forced the interaction to be these series of one-way utterances that are entirely arbitrated by the interpreter, we see that this doesn't conform to what we know about successful interaction. It's non-cooperative, it's non-aligning, and it's non-accommodating. So it's incredibly problematic. Now, luckily, there have been researchers who have talked about alternatives to this, but oftentimes very kind of strict machine model or mechanistic models of interpreting assume that everything must go through the interpreter, as opposed to allowing the participants to have some interaction between themselves. So let's look at some of the alternatives. Cecilia Wadenschow, looking at spoken language interpreters in her work Interpreting as Interaction, along with other research, has talked about the crucial place of interpreters not as the middle person or the arbiter of communication, but actually being a part of the interaction. Cynthia Roy's work, starting with even before, but interpreting as a discourse process, recognized that what interpreters are doing are not merely feeding information back and forth, but are contributing, that is, constructing the discourse with the other participants. And more recently, Danielle Claude Bélanger from Montreal has talked about interactional patterns in dialogue interpreting. And again, the words can be misleading. We're talking about dialogue because there are two participants, but the interpreter is still crucially a third participant. So let's take a look at what Bélanger has talked about. So as opposed to either the interpreter in the middle diagram or the typical triangular diagram, what Bélanger says is the actual interaction, not only the meaning, but the interaction is co-constructed by the two participants along with the interpreter. And that's a crucial point, that the interpreter is there present, allowing the interaction to happen. And according to Bélanger's model, there are various ways that the participants and the interpreters can interact, but they are all co-constructing and contributing to this single interaction together. Now, once Peter and I looked at this, we said, well, what is it that what is making this problematic? We've had researchers like Wadenschow, like Roy, like Bélanger talking about this, but we still haven't had a concept of role that's been promulgated that actually recognizes both the important place of the interpreter, but how they need to be enacting the role of interpreter. So what I'd like to do is just show you a quote from one of our works and then talk about the model that we are proposing. So there is no one size fits all, and that's obviously very clear. The other idea that's been problematic because of the idea of role as entity is that people talk about stepping out of role. Well, interpreters can act inappropriately, even unethically and illegally, but they are still functioning as interpreters. Just like if during a medical interview, a doctor is asked a personal question about their vacation, for example. They don't step out of role to answer that. They're still the doctor in that interaction. So what Peter and I tried to do is it said, well, we don't want it to be a free-for-all. We still think there needs to be constraints upon what interpreters do, but how can we define those constraints? Well, first of all, we need professionals, interpreters with integrity, and I think that that's probably non-controversial. But how else do we model interpreting in such a way that we can constrain it so the interpreter is not using power that's not theirs, but can contribute to the most successful interaction for the participants with which they're working? So since roles, again, are not something that we have, they are not entities to be had, or they're not cloaks to be taken on and off, that they are something we enact through our behaviors, we are proposing the concept that we're calling role space. And I'll talk about the details of that in a second. But the idea of role space is it's dynamic, it changes during the interaction, it's situational, it's affected and sometimes constrained by the individual language situation, but crucially, it's also negotiable with and amongst the participants. And it recognizes the central role the interpreter has in co-constructing meaning and interaction with, but not for, the other participants. So what I'd like to do now is we'll talk about the three axes, the three-dimensional axes of the model, and then we'll look graphically at it and give you some examples. So the first axis, and again, we're talking, if you think about an x, y, z coordinate system, where x is the horizontal axis, y is the vertical axis, and z is the third dimensional axis. The first axis that we're discussing is the z-axis, is the presentation of self. This also goes back to the seminal work of Erving Goffman. This relates to the roles that we take on in conversations, in interactions. Recall Goffman talked about the various roles that speakers, producers of language, and hearers, receivers of language, take on. For example, author, animator, ratified recipient, auditor. This axis, and we'll have some examples about this, talk about how the interpreter presents his or herself, not as the interpreter, but as a human being. Because crucially, we are human beings with communication skills. And how I walk in and introduce myself is going to be crucially different based on my gender, my race, my age, my nationality, my ethnicity. So how I present myself as a professional will be different with somebody else. But crucially, it is the presentation of self that's important. The second axis, which is the x-axis or the horizontal axis, is the axis of interlocutor alignment. And this is how we identify with the other interlocutors there. Again, recall we talked about sociolinguistically in terms of increasing and decreasing social distance, and psycholinguistically, how we jointly construct meaning. Crucially, in the interlocutor alignment, we're not talking about that we're favoring one side over the other, But there are times that we will be directing our attention to or directing our language at one side of the interaction more than the other for a variety of reasons in order for the interaction to be successful. So that's the second axis. The final axis is this. The vertical axis, or the y-axis, is the axis of interaction management. This is how much the interpreter is actively engaged in managing the interaction, either overtly or covertly. Again, the idea of role space is situational. There are some situations where there is much more liberty or freedom to manage the interaction. So, for example, in interpreting with children, there'd be a lot more ability to do that than interpreting, for example, in a courtroom or in a more formal situation. This axis includes things like turn-taking, managing turn-taking, managing overlapping talk or overlapping speech, and overt management strategies where the interpreter actively, overtly says something, or perhaps covert management strategies. So, for example, in asking for clarification, I might merely ask one interlocutor very quickly for a clarification without letting everyone know about that. So if you take all three of these axes, we can show you graphically what this looks like. And by plotting where interpreters are making their decisions in a given interaction along these axes, this creates the concept of role space, the interaction between and amongst these three axes. So let's take a look. So again, we have the horizontal axis, which is participant alignment. In the case that we're talking about, we'll be talking about hearing person on one side, a deaf person on the other. The axis of the presentation of self, how much the interpreter is present as themselves in the interaction. And the vertical axis, the axis of interaction management. What I'd like to do now is going to take you stepwise through each of them and then give you some situational examples that show you the various role spaces that interpreters can inhabit depending on the nature of the situation. So the axis of presentation of self, again, this is the front to back axis. On the high end is examples where the interpreter is authoring statements. For example, introducing oneself, crucially introducing oneself by name, or saying things, for example, like, excuse me, I didn't understand that, or can I have a copy of the handouts? In this case, I'm presenting myself as myself, not merely enacting the role of interpreter. So that's high presentation of self. And again, the points along the axis are dynamic. They do change. So it might be when I go into an unfamiliar situation where I have not met the participants, my presentation of self might be somewhat higher in order to familiarize people with who I am. And then later on, I can reduce the presentation of self during the rest of the interaction. Now let's look at the other end of the scale. So from examples of some low presentation of self is, for example, not referring to oneself by name, but merely referring to oneself as interpreter. So statements like, the interpreter would like a glass of water. The interpreter would like a break. Also, low presentation of self includes not responding to direct questions. Some models of interpreting have posited, because we don't want to have a negative impact on the situation, that the best way is not to say anything. That's incredibly problematic. In most non-antagonistic interactions, if someone does not answer a direct question, the interpretation of that is that the person is rude or angry or having a problem. If that's exactly what you're trying to communicate, that's fine. But if we're trying to facilitate successful interaction, but our behaviors are those that actually signal negative interaction, that is not going to allow these participants to align nor accommodate to each other. Now, that being said, there are times that low presentation of self might be very important. So again, in very constrained situations, for example, a courtroom, the presentation of the self of interpreter is going to be very minimal. Also examples of interpreting for spoken language interpreters in conference interpretings, where the interpreter is actually in a booth in the back of the room, is going to have little or possibly zero interaction with any of the participants. They won't have the ability, nor should they have the ability, to have any presentation of self. So high and low should not be taken as value judgments of positive or negative. It is how the interpreter is either choosing to or willing to present themselves or actively not presenting themselves for principled reasons. This axis is probably one that's familiar to most people, obviously just giving it a certain name. It's those behaviors or interventions even where the interpreter is actively managing the interaction, again, in terms of clarity, in terms of turn taking for a variety of reasons. So first, let's look at the high end of the scale. Some examples of high interaction management would be regulating turn taking, or deciding that interpreting consecutively would be the most effective, or phone interpreting. Especially for phone interpreting is problematic for many people in that an entire channel, the visual channel, is not accessible. So there oftentimes needs to be a high level of management to make sure that the interactions are not overlapping each other because they can't see or perceive that the other person, for example, is still using language. So often the interpreter in a phone interpreting situation must use a high level of management and a variety of strategies to have the interaction be successful. Again, the assumption here is that this is being done for principled reasons in service to the successful interaction. One example where an interpreter might not regulate turn taking might be in a situation where there's a group that wants to do a brainstorming session. The goal of a brainstorming session is not to have people speak individually, is to get as many ideas out as possible. If the interpreter imposes interaction management, they're actually thwarting the goals of the other participants. So again, negotiating what can and can't be done is very important. That's why along these axes, these are not unilateral decisions made by the interpreter, but they're done in consultation, in negotiation with the other participants. Let's look at the low end of the scale. In terms of low interaction management, obviously exercising no control, choosing not to regulate turn taking. There are consequences, obvious, of that. If there are multiple speakers or multiple people signing, I might not be able to perceive everything, so choices have to be made. But again, during a brainstorming session, that might be appropriate and in service to the goals of the participants. Again, conference booth interpreting, the interpreter almost never has a chance to stop the speaker in any way, so there is no possibility of interaction management. What's crucial about all of these axes and these concepts is these are decisions made during an interaction, but they could also be used predictively to look at what are the possibilities for a situation. If I go into a situation knowing that there's going to be little possibility for interaction management, I'm going to have a whole set of strategies ready, hopefully, in order to mitigate any possibility if I do misinformation. Okay? Now let's look at the final axis, which is the horizontal axis, the axis of participant alignment. So as it states, participant alignment refers to how much the interpreter is either direct their communication to or seeming to identify with a specific participant or subgroup of participants. In addition, it could also be that the interpreter is reacting directly to utterances made by the interlocutors. So for example, if during an interview a person expresses something that's very sad, the interpreter might have an empathetic reaction, for example, a nod and a concerned look that would signal that they're aligning in some way sociolinguistically with the person. Now, the important idea here is, as with the other axes, that this is dynamic and variable during a situation. This axis also talks about situations where, for example, in a platform interpreting situation, where I have little or no chance to stop the speaker, perhaps, but I have to communicate that maybe that the microphone has gone out and I can't hear the speaker. I might align with the audience to whom I'm interpreting to let them know that. So again, this varies during the situation and as the situation unfolds. So let's just go through a couple of slides just graphically to see this. And as we saw before with the monolingual interactions, we have sociolinguistic and psycholinguistic alignment. So alignment that is in service to the social distance between and amongst the participants, and psycholinguistic alignment, which has to do with the joint construction of meaning. So interpreters' behaviors can be in service to one or both of these ideas. So for example, It might be, as in the example with a platform interpreter, where I have little or no opportunity to stop the hearing person, but there's some problem with the source message that I can't hear it, or it's muddled. I might communicate and author statements to the deaf person to the effect of, I can't hear what's going on, what would you like me to do? Would you like me to paraphrase? Would you like me to catch it? What do you want to do? So that I am actually aligning directly in service to the situation. And of course, this can happen on the opposite side as well. So it might be that there's some message that's unclear from the deaf person, and I don't have a chance to maybe interrupt the person at the moment, but I will align with the hearing person saying, I'm not really sure, I think she's talking about X, would you like me to clarify, or what would you like to do? So notice these statements are authored statements. I'm speaking as myself. Also, it includes presentation of self. I'm saying I. What we'll see is that these are independent axes, but they're interrelated. But my behavior might be in service to participant alignment, but I might actually do it for example, by presentation of self. So that's the three axes individually. Let's take a look at them now, what it looks like when we put them all together, and look at some examples with role space. Before we get on to very specific examples, I'd like to talk to you briefly about a study done by Rebecca Leeds for her MA in the United Kingdom. What she was interested was, because she did a lot of medical interpreting, is what was the perception of doctors, for example, about the alignment of interpreters? Without directly asking that, but who did they think, or how did they think this person who came with the deaf person to the appointment, who was they? And let me just show you what the perception is, and I'll talk a little bit about her work. Rebecca undertook this work in Cardiff, in Wales, and she looked for, because of the National Health Service in the United Kingdom, she looked for those areas which had contracted agreements with interpreting agencies to provide qualified interpreters to doctor's appointments. So she wasn't looking at just any, she was looking at very, very specific situations where she knew it was professional, qualified interpreters who were accompanying the patient to the surgery. And she did a brief survey for the doctors, because as brief as possible to get the information. And what she found is that, again, these are patients who are attending appointments with their general practitioners with qualified professional interpreters. When asked, over 90% of the doctors said, because she asked questions about who is this person that comes with them, are they a family member? Over 90% of the doctors said that, oh, this person who comes with them is a carer of some kind, that they're responsible for the person. Qualified and professional interpreter was one of the choices, but 90% of the people didn't choose that. 90% of the doctors didn't do that. So the perception of alignment is very interesting. And one of the possible reasons for that is there sometimes can be an asymmetry in how we align or how we're perceived to align. So for example, if I'm in the waiting room with a deaf patient, chatting away for 10 or 15 minutes before the appointment starts, and that is perceived by the doctor or their staff, when we walk into the room and I choose not to align with the doctor or not to accommodate or not to answer direct questions, the perception is, oh, obviously you're with this person. You're not here to serve us in this interaction. You're obviously with them, and I am serving you. So our behaviors can actually be, even though they're not meant that way, can actually be interpreted to have the opposite effect in terms of alignment. So let's now take a look at a few examples of role space. When we plot the behaviors or the potential behaviors along each of these axes, what does that look like? The first example we're going to look at is an example of escort interpreting. So where the interpreter is primarily interpreting for a single participant, but not going to be involved necessarily with the other interaction. Classic example, there is a teacher of the deaf teaching a group of deaf students. A hearing supervisor who doesn't sign wants to observe the teacher, so the interpreter is there solely to provide access to the hearing supervisor about what's going on. So probably not necessarily verbatim renditions, but renditions something like, the teacher is now introducing a new lesson plan, that student is asking a question about the homework. So there is a single focus towards the one person, and probably very little interaction with the rest of the participants. Let's see what that role space looks like. So note that my alignment is very much with the single client, not with the other casual interlocutors. The presentation of self is probably going to be fairly high because the interpreter is actually providing information to this person and also might be making some meta statements about, oh, I'm not sure what she's saying, but it seems that they're agreeing. And the interaction management is going to be mostly, again, focused on the single interactant. There would probably not be any stopping of the interaction, but it's going to be very focused. So you notice it's a very one-sided view, but that's in service to this type of interpreting. Well, what happens if you flip this over, and what does the mirror image of this look like? Let's take a look at this. So again, the example of simultaneous conference interpreting, where I have little or no chance to stop the source speaker. However, my alignment is going to be, at least in terms of their meaning coming from them, probably very, very little presentation of self and very little ability to have interaction management. In terms of the audience, especially if we're talking about interpreting that's being broadcast, the interpreter might not know who their audience is, if there is an audience. They might have to have an idealized audience in their head that they're interpreting to, but they have little or no potential to interact with those people. Okay? So we saw escort interpreting is looking at one side. Simultaneous conference interpreter is actually the mirror image of that, in that the interventions, the choices, and the behaviors that the interpreter do to create that role space. Let's look at another example where it's simultaneous interpreting, but we get a little bit different space. Notice the shape is a little bit different here. It's a little more centralized. The example here would be interpreting of an ongoing training course. So let's say it's a one-week computer training with the same teacher, the same trainees over the course of a week. Because familiarity, it's very difficult if we're more familiar with people not to present ourselves. During the course of this example here, you see there is slightly more presentation of self. The range of presentation of self is greater. The alignment actually does move between the two groups. And interaction management is probably going to be erring on somewhat on the higher side, especially if the information itself is important for people to know. I'm probably going to take the responsibility to make sure that the information is clear as possible. So even though we saw simultaneous interpreting at a conference looked a certain way, the training course, because of the situation, because of the relationship and nature of the interaction and the participants, you see a different role space. Now, the next example we're going to look at is a little bit complicated. So I'm going to show you the picture first, and then we're going to see a couple of different shapes, and I'll explain what's going on. This example comes from Peter Llewellyn-Jones, my co-researcher, where he was in a situation where there was a deaf defendant for a trial, very complicated trial. In this situation, there was a barrister who is the court representative but represents the client. There was the solicitor, who is the lawyer for the client, and two interpreters. During the meeting with the barrister, in order to figure out what was going to happen when they went into court in terms of pleading of charges, you notice the interaction management is very high because the level of detail is crucially important. So the interpreter is going to err on the side of being very, very clear and making sure that they manage as much as possible the interaction. Presentation of self by the interpreter is very little, if not almost negative, because given the situation, the important interactions are the barrister, the solicitor, and the defendant. So there's very little presentation of self, and alignment is very, very, and I hesitate to use the word neutral, but centralized, in that there's going to be very, very little movement along there. Now, during this situation, it was decided that the defendant was going to plead to certain counts. So the barrister left the room to go talk with the court to see what the potential is that. So for about 35 minutes, the barrister left, leaving the defendant, the two interpreters, and the solicitor. This is what the role space looked like then. So the barrister leaves the room. The other participants are left in the room. If you've ever been in a room with people, it's very difficult not to say something and not to talk. So the interaction that was happening here was not about the case. It had to do with people talking about what they wanted for lunch. So notice that the presentation of the self of interpreter gets greater. The alignment goes between the defendant and the solicitor and other people in the room. And interaction management, because it's going to be somewhat more informal, tends to be somewhat higher. So again, one participant leaves the room, the actual situation is similar, the topic is different, and therefore the role space is different. The barrister then returns, says we're going to go into court and we're going to plead. Now let's look at the role space now of what happens when these interactions go into a courtroom. So notice you get a much more narrowing of the role space. The presentation of the self of interpreter is as negative as possible. The interaction management is still there because of the primacy of the importance of the information, but the alignment is minimal. Okay? Even smaller than in the pre-meeting with the barrister. So again, the hearing itself, the court situation, does actually provide some constraints on what can happen here. So even over the course of a couple of hours with the same participants, you can see how the role space itself is dynamic. Sandra Hale did a study of a variety of codes of ethics of interpreters in a variety of countries. And what was interesting is a lot of we plotted the role space of a lot of these codes, and they tended to be very strict, and they tended to look something like this. Most of the codes had wording such that presentation of self of the interpreter was disallowed. Interaction management was highly valued because of the primacy of information, but alignment with participants was not. And as we've seen, this idea of alignment, how much we're able to align with the participants, actually facilitates them aligning and accommodating with each other. So one of the issues that we're looking at is, are the codes of practice, conduct, and ethics that are written for interpreters actually reflective of A, what real communication is, and B, what we know interpreted communications can be. The example I have now is the current code of ethics in the United Kingdom for the regulatory body of interpreters. It's the National Register of Communication Professionals working with deaf and deafblind people. And this is what the role space of the current code of ethics in the UK looks like today. So, as you can see, interaction management, pretty highly valued. Slight bit of presentation of self, but most of that is only if the interpreter has to declare any conflicts of interest. Alignment with participants, very, very prescribed. Now, one of the things that Pete and I talk about is that if you look at this, is there any situation, besides very constrained situations like we saw with court, where this is actually the role space of a communicative interaction? If it's not, it's very problematic that the code says this is the limited space that interpreters have to work. So we feel, and we'll talk a little bit about implications now, that we need to look at what successful interaction is, how do we model that, then how do we codify that in a code. So let's talk about some conclusions and some implications. So some conclusions and implications of the role space model. First, let's go back really early. In terms of screening and teaching potential interpreters, we are very cognizant of, and I think rightly so, about the linguistic capabilities of students entering interpreter training programs, and I do not want to take away from that. However, I think if you look at the areas, for example, of alignment and accommodation, what are the skills, what are the social skills that students are bringing? How adept are they at dealing with a variety of people? How familiar are they with the accommodation and alignment rules of the variety of languages and cultures that they work with? Many of you can think of examples of interpreters or students who have very, very good language skills, but might not have very good social skills. If it's very important to align and to be successfully align and accommodate with participants, and students don't have those skills, they either need to be screened for or trained for. And I think we should be putting a focus on that type of interaction and having that skill set be important. Or if it's someone who's not interested in communicating and interacting with people that way, perhaps counseling them to the types of interpreting that might be appropriate. So platform interpreting might be more appropriate for someone who's less comfortable with social situations. Some other implications, for example, for team interpreting or co-working. When we first developed this model, what became obvious to me is it was helpful in explaining that there are some colleagues who I work with who are as skilled, if not better, interpreters than I am linguistically, but we don't seem to be able to work together very well. And I think it's because we might have very different ideas of what the role space is for certain situations. And I think participants, deaf and hearing, can actually perceive that in some way, shape, or form. The language might be clear, the message might be clear, but how the interpreter fits into the interaction might actually be palpable in a different way to the participants. So I think in terms of team interpreting, how we negotiate that, not just negotiating who's going to do what in the situation, but how we believe in our schema for the role space. Also, some situations might lend themselves where the interpreters actually split the role space. So in a complicated situation with multiple deaf people and multiple hearing people, it might be that one interpreter aligns more with the hearing people in order to take care of that side of the interaction, and the other side aligns more with the deaf people to allow more potential overlap. So the fact that this doesn't have to be something that is solely done by an active interpreter or a non-interpreter, but the role space can actually be shared by two interpreters in order to facilitate that. Some other implications, I've already mentioned court. Certain specialized settings might call for certain role spaces that are different. So ongoing situations are different than a one-off situation, for example. If I'm working as a staff interpreter, the role space I have with the other staff members will be different than if I'm a freelance interpreter who's just going to a one-off assignment. So I think that's important to think about. And finally, as mentioned, codes of practice and conduct. I think it's important that we have codes that are reflective of actual good practice and actual practice, what we know leads to successful communication. Having a code that doesn't reflect that, it doesn't serve anybody. It doesn't serve interpreters, and it certainly doesn't serve the deaf and hearing people with which we work. So, in conclusion, the concept of role has been problematic for a while. We think if you don't look at role as an entity, but rather something that's created dynamically with the other participants in the interaction, that will lead to more successful interactions. And this concept of role space, how much space we take up during an interaction dynamically, is crucial for interpreters to look at. At the end here, there are a bunch of references to some of the work that we've done and some of the foundational work. I want to thank you for your attention, and I hope you found this interesting. Thank you very much.
Hello, everyone. I'll be starting to get some questions in, so I'll be reading them off as I get them. Please feel free to type them into the Q&A area of the screen. I'll read the question off. This says, I am finding your presentation to be quite fascinating. Thank you. I would like to praise you for acknowledging that teams of interpreters definitely have different perceptions of their roles and alignment with each other's. I like to put the deaf person first. I think it is important to recognize that we are different people. Just as interpreters have different linguistic skills, but we try to kind of make an equivalent experience for everyone that we're interpreting for. I think we also bring different things to the task. And I think it's important to recognize that. And sometimes it might be one person has strengths in certain areas and could take over that part of the role, if you will, for certain interactions. So thanks for that question. Someone did ask a question about what a barrister is. I used the word barrister that was in the example. It's a legal role here in the United Kingdom where it's someone who represents a defendant to the court. So they're not a lawyer like we would think about representing the client in the same way, but they're kind of the liaison, if you will, between the court and a defendant. It's actually a kind of legal role we don't really have in the United States, which makes that example rather interesting. Any other questions? there is a question about how this model would interface with demand control schema. And that's a very good question. We get asked that a lot. And I've actually talked with Robin Dean about this. If you think about, those of you familiar with demand control schema, talks about the demands of a job, in our case, interpreting, and the controls or that an individual interpreter might have. You can think along each of these axes that there are a variety of demands that the situation would place upon me as an interpreter, and hopefully some controls that I can enact. So also, I mean, that's why we tried to think about what are the strategies, for example, of interaction management that I would have given the nature of a situation. So we see actually that these models can actually interface with each other, where we're talking about the abstract idea of interaction management. Demand control schema would talk about how that might actually be implemented. Just trying to get, I have a couple of windows open here, so forgive me if I get a little confused. Someone was asking about emailing or making copies of the PowerPoint presentation available. And yes, Hillary will make that available. There will be a PDF of this PowerPoint, which will include the references. Right, I'm sorry, I have a, could people, I'm sorry, people are typing in two different windows. Could people type their questions in the Q&A window only? Because people are actually chatting, they're sending it in the chat window, and it's a little confusing. So I'm trying to look at the multiple windows. Right, so I did answer that we will make the PowerPoint available. And we do have some, we have a book that will be coming out next year that will be outlining the model in a lot of more detail, including the kind of theoretical background of the model. Also, I have, there's a couple of PDFs of short articles that we published in the past, so I can make those available as well. Someone asked, how will this model impact the current code of professional conduct of NAD-RID? That's a very good question. I'm not sure how it's going to impact any code, to be honest. As I said toward the end, if this is indeed a model, an abstract model of interpreted interaction, and talks about the variety of ways that we can successfully allow people to communicate across languages and cultures, I think codes need to recognize that. We are currently looking at hopefully doing a revision of the code of practice here in the UK. And some people have talked to us to make sure that hopefully we'll be involved in the conversation so that the codes are reflective of actual good practice. So that remains to be seen. This is fairly new work. We've only been doing this about 2.5 years now. So we're not really sure to answer your question. But we found it as both educators and interpreters to be very helpful in helping to, again, prepare for work, analyze work, and also think about how to approach the idea of role in a little different way. So let me see where other questions I have here. Someone said, thank you for covering what's an enormous topic in a short amount of time. Thank you. Yeah, it is. It is a challenge. I could talk about this for hours. The next part of the question is, I'm curious as to whether any of your studies include live video demonstrations of alignment theories of interpreting. What we're doing, and part of what we'll be doing for the book, is actually using some examples from the interpreting literature that have been looked at in the past and applying our model to them as well. So looking at some of the work of both spoken language and sign language interpreters to kind of recast how people have talked about alignment, accommodation in a variety of ways. So looking back at the work of Metzger, for example, Cynthia Roy, and a variety of researchers, and trying to reframe some of what was said there, which I think is still relevant and valid, with the terminology of our model. Peter and I both feel that what we're doing is we're giving vocabulary to things that people already know about. We think it's a fairly common sense approach, but it's providing a shared vocabulary to talk about the work in a very similar way. Someone said, how can we Next question, sorry. How can we mitigate the perception that the interpreter is aligned with the deaf person without using a high presentation of self? I think to we need to be able to align with both or all the participants fairly equally. I think what happens is, in many cases, we do align with the deaf person for a variety of reasons. We might actually know the deaf person more, or from a variety of situations. But I think we also have to do some expected alignment with the hearing person. Just by it doesn't have to be high presentation of self. Merely by introducing myself to the hearing person as a fellow professional, for example, if it's I'm interpreting a professional meeting, that is enough to kind of mitigate that people feeling that people are taking sides. And I think a lot of what we're talking about is using common, expected ways of communicating in the cultures of the participants. So myself walking into a room and acting like a professional of a certain age, of my gender, of my height, would be expected to act without appealing to some kind of special idea of role. Let me see. Someone says, how would you recommend a more equally aligned experience for a medical appointment before entering, for example, the waiting room? Well, I think one of I used to do a lot of medical interpreting, and I think what happens oftentimes is that we are perceived again as being aligned with the deaf person because we sit and chat with them in the waiting room. But I think again, by presenting ourselves appropriately as a professional to the hearing people in the situation, that will mitigate that, and maybe even explaining that we were just chatting in the waiting room, so I was we're getting familiar with each other's languages. Just telling people what we're doing, basically. And I think the more we're open about what we do on both sides of the alignment equation, the better it is for everybody. Let's see. Sorry, I'm just looking at a couple of things. Someone says, do you see any differences in the roles of sign language interpreters in the US versus the UK? In terms of actual practice, I think the same range exists in both countries. There are some people who have very, very strict idea about what the role should be. There are some people who have more, let's say, expansive ideas or a range of ideas. I don't see that much difference. I think the work itself is very similar. The language, the sign language is different, obviously. But I think and that's why it's interesting, because my colleague, Peter, and I, Peter's from the United Kingdom, I'm from America, even though I'm living and working here now. Even though we came from different backgrounds and different countries, we have very similar ideas of what effective interpreting is. So I don't really see that much difference. And I've also spoken with spoken language interpreters, and this resonates with them as well, because I think it does model fairly well what us as extra people in situations are doing in order to facilitate communication. Next question. Sorry, I'm scrolling down here. There's a lot of questions. I'm not sure I'll get to all of them. I apologize. Someone says, hi, Robert. Oh, hi, Chris. I like the label role space rather than role. Even this seemingly simple difference allows for more flexibility. It also, to me, recognizes the professional judgment and allows me to fit the situation. Thanks. I agree. And when we came up with this, we put that word space next to role. For me, it it really helped to explain how it feels to be in the situation. There are times I feel I'm taking up more space because I need to, because I have to manage the interaction more. There's a variety of factors going on. There's other times where I feel very small in an interaction, and that feels appropriate. And I think for me, again, the metaphor of space is helpful. And we came up with this idea of kind of a 3D axis to represent that, because it does feel like this different dynamic space that we're moving through. So yeah, it resonates with me too. Let's see. I have a couple of people who also let's see, I'm sorry, there's a lot of them. How would you advise an interpreting student to analyze and work on role space when this is so new that our mentors may even be aware? Uh, well, I think, as I said, I don't think we're creating anything new. I think we're giving language and terminology to ideas, concepts, and behaviors that we already do. And part of the idea of presenting this webinar and then follow-up activities is to allow people to reflect on how they think it works. So for me, it's looking at specific behaviors that I might do, or interventions, if you will, as an interpreter, and seeing, well, what am I doing? Am I managing the interaction? Am I presenting myself? Am I doing some form of alignment at the time? And trying to get used to using the vocabulary and the labels to figure out if that's what I'm doing. And I think this is the kind of model for me, anyway, that feels like it needs to be worked on and applied. I'm still working on it myself. And it is a work in progress as a model. And I think that what we hope is that people will try to find a way to work on this together. Which is why some of the activities that, if people are interested in the follow-up activities, would be working in groups to kind of figure out this, how this applies to their own work. Someone said, I want to make sure I heard you correctly. You're advocating aligning with various participants in order to decrease the social distance and improve the interaction. That's part of it, yes. Part of the main point is that if I can't align with the individual participants, it's going to be very difficult for them to align with each other. So that diagram I had where the interpreter is literally in the way, and is literally in the middle and just being kind of the conduit without allowing the other participants to have an interaction themselves. And I think it's important, just by aligning with each of the participants, that allows them to align with each other. One example I've given in the past is we often, and I'm guilty of this, we often get very precious about the interpreting, that we have to interpret everything. So for example, if a hearing person during an interview is asking the deaf person, how many children do you have? And the deaf person holds up 3 fingers. And the hearing person can see that, and they understand 3. As opposed to voicing 3, sometimes just allowing them to see 3 and them to nod and go, oh, 3, me too, allows the 2 of them to align and accommodate without having me getting in the way. So sometimes just allowing people to have an interaction by themselves without having to be the one who always gets in the way, that's often more effective interpreting. Because again, it's if you think about, I'm not just interpreting between and amongst people, I'm interpreting a situation. And sometimes the best thing I need to do is just get out of the way for a brief period of time. Let's see, I have a couple of other things. Someone said, how does one watch for themselves for empowerment and disempowerment of communicators? Not sure exactly what's meant by that, but I think it's important that we are aware of not taking power away from anybody, which is why I think looking at these axes as, are there times that I'm going to, in order to empower someone, it might be aligning with them briefly. So I think that's, if you're aware of where your alignment is at any point in an interaction, that might be, hopefully gets us on our radar about keeping people empowered, if I understood the question correctly. Someone said, have you looked at how this model applies to video interpreting? We've got asked this question a lot, and I don't have direct experience myself with doing VRS, although I've done some VRI. So I've done remote interpreting, but not necessarily video relay interpreting. What I've been told by some people is that what's helpful about this model is it's descriptive. So you can model a situation using these 3 axes. Now, it might be that I'm told in this situation my role space needs to be a certain way, but I feel that my role space needs to be a different way. And I think that's a helpful way of looking at, am I being told to do things that might be counter to effective communication? Um, and I will leave it up to people who are doing more VRS to take this model and run with it, because I'd be curious to see that. So some people have said that they feel certain times when they've done certain type of VRS work that they feel very constrained, that they can't use the strategies that they feel would be effective. So what that says to me is that is not allowing someone to be an effective interpreter. Sorry, I'm trying to look here. How do I suggest this methodology is taught to students? I think for me, when I've taught it, what I found effective is going back as I did in the lecture is saying, what do you do when you communicate every day with people? How do you communicate with deaf people? How do you communicate with hearing people? What do you do to manage the interaction? How do you present yourself? How do you align? So having people analyze what their own kind of default baseline is in each of the languages with which they work, then talk about, okay, how do we apply that to an interpretive situation? And that's why I mentioned toward the end, I think it's important that students have a sense of their linguistic skill is very important, and I do not want to diminish the importance of language skill for interpreting students. But I think social skills have been put in the back burner. And I think that's what helping students to understand what their impact on a situation is personally. I'm about 6'1". I weigh a certain amount. I have a very different presence in a room than someone who's 5 foot tall and 20 years younger than I am. So realizing what my own impact as a person is in the situation is important, and what I might need to do to minimize or maximize that. And I think helping students to understand who they are as people and communicators before who they are as interpreters. Okay. Someone said, can you give some examples of how a team of interpreters divide the responsibility of alignment in order to benefit an interaction and communication? Great point. Great question. One of the ways I think of this, if you have a fairly large interactive group, say 5 deaf people and 5 hearing people, sometimes we think about dividing the language. So it might be that I take all of the English to ASL, and then the other person takes all the ASL to English. We kind of divide the language. But it might also be that by doing that, we're also kind of aligning more with the participants. So if I'm mostly doing the interpreting from ASL to English, let's say, for example, I'm going to be aligning more with the deaf people in terms of understanding them, in terms of reacting to what they're saying. So in some ways, providing the by looking at how we divide the language is also how we divide the alignment in some ways. Someone said, will there be a consumer version of this work? I'm assuming that question would mean, are we going to talk to deaf and hearing people about this? Sure. I'd be more than happy to. I mean, I do talk to both deaf and hearing people about it as well. Both, hearing people who aren't interpreters to kind of explain what I do. And I might not use the terminology so much, but I might say things like, if I'm doing, for example, high interaction management, I might say something like, because this information is important, I might need to interrupt you a few times just to clarify for myself. I hope that's okay. So that's how I would, both through presentation of self, but in service to interaction management, I would do that. I would be happy to. I want to get this understood by people if it makes sense to them. So yeah. Let's see. Just trying to. Someone also made a point about this would very much apply to deafblind interpreting. as the alignment between the deafblind person and the interpreter is much closer. That's actually a great point because that's another great example of the alignment being on one side of the axis, and also why some people may be more or less comfortable with that kind of interpreting because they might not feel as comfortable being that aligned with somebody, or they might feel very comfortable. So, good point. Um, Still scrolling down. Sorry, I can't get to everything. Next question. What do you think this model might suggest about how we measure, assess work effectiveness, especially in regards to certification? Wow, an easy question. That's a good question. I mean, I think when I look at student work, part of what I do look at, especially in when they're interpreting between a deaf and hearing person, so a two-way interpreting, not just one way. I do look at what are the strategies they're doing to align and accommodate and allow that to happen. And I think we need to figure out metrics for that. So we might have someone whose interpretation itself is very accurate. All the propositions in the source language or in the interpretation, the very clear rendition in the target language, obviously understood. However, people are not aligning and not feeling that they've connected. That might not be a successful interpretation. So how we define success might have to include some of these things. Some people have also, again, there's a few people who have mentioned about having some written material. Again, I'll be providing both the PDF of the talk as well as a couple of short papers to Hillary, so Hillary can get that out to people. I hope that's okay, Hillary. And she says, "Yep." Thank you. Another question. Interesting information. Wonder how to apply it when addressed directly, whether to interpret the question or comment posed to me and then respond directly. This comes up quite often and concerned with how it affects alignment with the people involved. Well, that's a great question, and that's one of the things that got us starting to think about this. The strict machine model would say that we just interpret the question and we don't even answer it, which I think is not optimal. However, if I'm a sole interpreter working, I would tend to probably interpret the question and then say something saying, "I can't answer that now, but if you want to talk to me later, that's fine." If I'm team working, again, that's one case where it might be that the question gets interpreted. I provide a short answer, and sometimes by providing a very short answer, which is a very quick form of alignment, allows people to just go, "Oh, okay." People will. My computer became unplugged. Just one second. Sorry. One of the examples that people talk about is if you're in a group and everyone's going around saying their name, and people say, "Well, the interpreter shouldn't say their name." Well, what I feel is, and I've been interpreting for over 25 years, if everyone goes around and I don't say my name, everyone's going to remember I didn't say anything. However, if I very quickly say, "I'm Robert, I'm the interpreter," and move on, no one's going to remember that as a horrible violation of any law. And by doing that, what's expected, that kind of normal behavior, and a lot of what we're talking again is normal behavior that people do in interactions, then allows people to get on with their work, and it stops making us feel so special. Someone said, in relation to the idea of teaching potential interpreters with this model, do you feel there's a way to teach students to increase their social skills in order to do other kinds of interpreting? Can this be taught? Good question. I think people in general need to have a natural aptitude for the variety of skills that interpreting requires. That includes linguistic skills, obviously, and includes social skills. There are some people who are going to be probably adequate communicators, but might never be interpreter level because of their linguistic skill. There are some people who might be adequate communicators, but not good interpreters because of their social skills. And that's where we need to look at counseling people in terms of what would be appropriate or not. Um, so I don't think everything can be taught necessarily. I think there needs to be a baseline of natural aptitude and crucially awareness. So I think it's important that, and that's why I mentioned before, that we make students aware that this is all part of interpreting. The ability to be comfortable in a situation. So people are comfortable with you, not only linguistically, but just as a person. Um, Boy, lots of questions. Thank you for these. This is really great, by the way. Somebody said, what about presentation of self and a staff position in a place such as a post-secondary setting, where you're working with people who share the same level of power, but the interpreter does not? For example, deans, faculty, students. I think that's a great question. And having worked in both staff positions and as a freelancer, I see my capability of space being different. So, for example, having worked as a medical interpreter as a staff person, I felt very different because I had a professional relationship with doctors and nurses and physical therapists, for example. So my presentation of self would be as a fellow staff member. But it's also recognizing that the interpreter might have a different level than everyone else. So perhaps what you're talking about, there might be a deaf faculty member and a hearing dean, and then there's the interpreter, who is somewhere in between or on maybe even lower than the faculty member. And I think it's recognizing that what are the functions of the staff person in those situations. Because in many situations, there's an imbalance of power, even amongst all hearing people or all deaf people. So I think it's recognizing where do we fit into the equation, and how do I present myself as a fellow professional to my colleagues, deaf and hearing. Sorry. There's so many questions. Someone said, some of you missed the beginning of the presentation because of technical details. Sorry about that. Can you provide a general definition of role space? Right. What we're talking about is the role space is literally the space that an interpreter takes up in an interaction that's defined by three axes. So interaction management, which is up and down, the horizontal axis, which is alignment with the various participants, and the presentation of self, which is the forward and back axis. So it's the fact that interpreter role is not something that we have. So it's not something that we put on like a jacket or a coat. And often the metaphors, and Cynthia Roy has spoken about this for many years, that the metaphors about stepping out of role or stepping into role don't really fit. But if we think about the fact that we enact roles, and this is what sociology teaches us, sociological theory back to the 1930s talk about people enacting roles through behaviors, both linguistic behaviors and physical behaviors. So how we actually behave in a situation creates the space that we take up, the role space that we take up as interpreters. Says, question, I believe that many interpreters do this, and I assume these behaviors, without formal training, with experience, as I am sure you have found in your research. What I find interesting is the theories and graphics, but showing true interpreting to students for formal training for modeling. I don't think I understand that, sorry. I think a lot of what we're talking about is using our intuition and our knowledge of how to communicate appropriately. But we have to do that with two groups of people and two languages, or at least two languages and two cultures. Someone did actually ask about, sorry, I might have missed it, about trilingual interpreting. I think that's really interesting because if you're talking about interpreting between and amongst multiple languages, I might have multiple interaction management techniques, multiple types of alignment, so how I might align with certain groups in one language might be different than others. So I think it does apply, and again, it's all new, so we're trying to figure that out. Just trying to think. So can you talk more about allowing interlocutors to align, cooperate, etc., at the beginning of or during an interpreted interaction? I like this idea and would appreciate examples or descriptions of what this might look like. I think that's similar to what I might have mentioned before, where if the deaf person signs 3 and the hearing person says that and might sign that back or copy the sign, and kind of allowing people to do that. Or the hearing person might either ask us, hopefully asking the deaf person, oh, what's the sign for that? So allowing them to have a little interaction in sign language by themselves might be very aligning. So that allows that kind of creates that. And I think that's where we need to create the space to get out of the way. That's where we would pull back the presentation of self and let them have at it. So the hearing person might learn one sentence in ASL, but that creates an alignment and an accommodation between them that allows them to get on successfully. Someone said, can you hypothesize how role space alignment conversation could be applied to interpreters who work in religious settings, particularly in worship, Sunday church, or Sabbath? I think this fits. I think it's an interesting area to look at because you're talking about how do I align with people in a very specific cultural setting, and that's adding another layer of culture. So in this case, a religious context. So I think it would fit in very well. There's people who say that it's sometimes better to have a person who's a member of the faith being the interpreter. Other people say, well, it actually might be better to someone who understands but is not a member of the faith because of potential too much alignment. And I think the conversation about how much alignment do we want our interpreter to have? Having done religious interpreting in a tradition which is not my own, but I am comfortable in, sometimes allows people to align amongst each other because they're not going to worry about my worship. And so that by being present enough to facilitate the communication, but not present enough where they're worried about my participation, I think is thinking about that alignment and presentation of self. I've been given the 5-minute warning. And Hillary does have some announcements. Someone said, did you already mention the name of the book, or would you rather not say? Well, we're working with Bloomsbury, Bloomsbury, publishing company. The tentative title is, I believe, the role of community interpreters, the concept of role space. So because we're looking specifically, even though this model I think applies to all interpreting, it's much more an interactive model. So it does really apply mostly to interpreters who are actually interacting with the other participants. A couple of people have asked about deaf people's responses to this. Again, I've talked to a bunch of deaf people about this, some of whom are trained interpreters and some of whom aren't. And the response I've actually gotten has been interesting and very positive. For some deaf people, one friend of mine said, oh, this helps me because there's some interpreters that I don't feel comfortable working with. It's not because I don't understand them or I don't think they understand me. I think their language is clear and I think they understand me clear, and I trust that they're interpreting accurately to English, but they just don't feel like they fit in. And I think it's, again, giving vocabulary, not totally to, but the concept of attitude for deaf people. Something about, maybe part of what alignment is for some deaf people, and even maybe for some hearing people, is, I feel they align with me appropriately, therefore they have the right attitude. So in some ways, again, I don't think we're creating anything new. I think we're giving a package and labels to experiences and behaviors that people are familiar with. Um, Someone said, just this is helpful. Going back to the question of how to avoid the perception in medical settings that we're with the deaf person. Sometimes language can help. So when introducing oneself to the doctor, hi, I'm Robert, the interpreter. We'll be working together today with, patient X. And I think you're right. I think, and that presentation of self is, hi, I'm a person, and then getting out of the way. So I have to make some announcements now. I don't, and someone, oh, again, I'm sorry I didn't get to all the questions. There were a bunch. There will be a potential follow-up, which Hillary will is on the website. Follow-up activities for CEUs and everything. So I am now going to make announcements, right, Hillary? I think. Yes, she's telling me. I'm just following orders here. Now I'm going to have to read off the teleprompter. Right, sorry about this. Right, so I am now reading the announcements. Please stay on when Robert disconnects, as you'll be directed to the post-assessment. Everyone should take the post-assessment, please. Not just those that want CEUs. Everybody. Announcement number 2. We will have an online learning community on this topic starting on January 7th. That will have a maximum of 100 participants. So that's for the actual online learning community. However, there's an archive presentation. So what you saw tonight will be available on January 7th. So if people missed it today and they just want to see the presentation, they can do that on January 7th. And that information will be available again on Gallaudet's website. Number 4, Hillary will send the PowerPoint to all participants. And I'll also provide PDFs of the 2 short articles. So if people would like that as well, I will be able to do that. Oh, make sure you're on the mailing list to get the announcements. So get on the mailing list, however you do that. Oh, thank you for joining. That's from Hillary. And from me, I really appreciate, first of all, I want to thank the interpreters. And I want to thank Gallaudet for setting this up. As you can tell, this was a recorded presentation. I look a little bit different now. So this was a little experiment. And we're looking forward to the online learning community. We have some exciting, interesting activities. So again, there'll be information about that. And everything was great. And I really appreciate everyone's attention. I'm sorry I didn't get to all the questions. Unfortunately, that's the nature of the beast sometimes. But I really appreciate everyone's attention. And hello to everybody out there. It's getting late here. It's what time is it here? I can't even figure out what time it is. It's later. Please hold on. The instructions in the chat window for the post-assessment will be there. Thanks to everyone for joining. Thank you to the interpreters. Thank you to Bev Holra and Hillary at Gallaudet for making this all happen. And I guess that's it for me. Thanks, everybody. Bye-bye.